Targeted therapy. This is the most commonly talked about therapy in the present day for management of cancer patients. How does a targeted therapy work and how is it different from the conventional treatments which we were giving earlier? Chemotherapy, as we know, usually acts on all cells. So this cytotoxic chemotherapies which we see kills all the actively dividing cells in the body. So by doing this, we are not only killing the normal cells, we also kill those actively dividing cells in the body like hair growing cells, the cells in the oral mucosa, the cells in the bone marrow. For this reason, we see a lot of side effects when we give chemotherapy. So targeted therapy usually goes and switches off the mutation which usually causes this cancer. So before we move to targeted therapy, we need to know what's the science behind it. So a lot of research is going on in cancer, and the research is to identify a target which can be switched off. For this reason, we see every couple of months a new drug coming into the market for the treatment of these cancers. A lot of research is being done in lung cancer, breast cancer, colon cancer, you name it. I think the cancer research is evolving rapidly at a pace never heard before. In cancer treatment, whenever we are considering this targeted therapy, usually what we see is what's the organ or the mutation where this is going to work. The first example of the targeted therapy happened way back, almost 2 decades back, in the treatment of CML. CML is a type of blood cancer which is chronic myeloid leukemia. So the research was done and they have identified that there's a small mutation in a chromosome which was named as Philadelphia chromosome. And the later research was done how to stop this mutation. This mutation, what did it do? It was like a on button. It made the cells continuously divide and replicate continuously. So with this mutation, what happened was the cells were dividing continuously. This was causing cancer for which there was no treatment. And what did the researchers find out? They found that there's a single drug which will go and block this mutation. So by turning off the mutation, that cell growth is stopped, and what is happening? The patients are going into remission and few of them are even having a cure. The same thing was replicated later in various cancers like lung cancer, colon cancer, where by identifying this mutation, we are able to also identify a drug which targets this mutation and helps in long-term control or at times cure of these cancer patients. So there's a lot of research going on, and with this targeted therapy, which is very selective in killing these abnormal cells which carry this mutation only. So by not attacking the normal cells, what we are seeing is we are having less side effects, the result is better, and patient acceptance is more. So that's the way this targeted therapy has changed the way the treatment landscape of cancer and the way it is treated.
If you found this video useful, like, comment, and subscribe for more health updates.